Tomorrow, a CDC advisory panel plans to meet to consider new FDA recommendations on booster shots for children. So FDA is now recommending kids at 12 to 15 should get an extra Pfizer dose, as well as some children with compromised immune systems between ages 5 and 11. The agency also says that everyone immunized with the Pfizer vaccine should get a booster shot 5 months after the second dose instead of 6. The change is now awaiting final approval by the CDC. And amidst rising pediatric COVID hospitalizations, some school districts have elected to go back to remote learning, while others are choosing to stay in the classroom. But that may be easier said than done.
A lot of teachers, a lot of staff are going to come down with COVID, and whether schools are going to be able to remain open with a limited staff, with reduced staffing, we'll have to see.
Well, after some harsh criticism, the CDC is considering clarifying that new 5-day isolation guideline for people who test positive for COVID. That's also expected to happen tomorrow. Well, several hospitals in our surrounding counties have been experiencing new pandemic-related problems over the past few weeks. Our Jenny Runovich went to Shelby County, where supply chain issues are causing concern there too.
As if hospitals aren't dealing with enough right now between the COVID surge and a staffing shortage, now some are also seeing a shortage of supplies.
Simple items like crutches, tape for wound care, needles for insulin, plastic basins for patients' bedside, running out or not getting delivered. Hospitals plan ahead when ordering materials, but they say lately it's been unpredictable. Their normal vendors depleted without warning. At Major Hospital in Shelby County, they're now trying to conserve, sharing supply with other suburban hospitals, and at times even having staffers make a run to the local pharmacy on their way to work.
So we were going out to the retail, hitting up CVS's, hitting up Walgreens, hitting up local DME stores, trying to find enough crutches to be able to meet the needs in our system. Because somewhere, a factory or a manufacturing organization creates crutches and they weren't meeting the supply.
Well, the supply chain issues are also causing financial problems. If you'd like to read more about what this is costing those hospitals and why it could get worse, head to WTHR.com.